And we have with us on the line once again this morning Dr. Mark Hirko from Sharon Hospital, New Vance Health. Good morning, Mark. How are you this morning?
Good morning. Good morning. Happy morning. First day of winter.
First, and it feels and looks like winter. But anyways, we'll get to that. Before I get, we're going to get to the testing at Sharon Hospital. But the news that came out of England and Europe this weekend with of course a virus, they always mutate, but this a more virulent and more easily spreadable COVID-19. Has that raised eyebrows in New Vance Health and the hospital as well?
I mean, we're always being vigilant, and I mean, we are, here on the East Coast, so we're a major portal of entry for a lot of people coming in from Europe. But again, the good news is, based upon what we're hearing about the vaccines and stuff like that, there is yet to be a variant that has not been susceptible to the vaccine. So that's a good news.
That is the good news. All right. Now, let's talk about Sharon Hospital testing, because testing for COVID-19 is available at Sharon Hospital, right?
Yes, it's been for the last 6 months now. So what you do is you ask if you want to test, you have your family physician write out a prescription. Then you actually contact Sharon Hospital. They'll forward you to the appropriate line where you go ahead and schedule a time for the test. Then you would arrive, stay in your car till they call you in, and then you come in, get tested, and then go out. And then if you don't have a prescription, then on the off chance that happens, then you would still call, schedule the test, and then if you don't have evidence of the prescription, then the hospital will provide one.
All right. So now, and it appears like making people wait. I mean, people question sometimes the security and the safety, but I think your record at the hospital throughout this whole crisis shows that really everybody at the hospital, inside the hospital, has got the highest standards. And you really, if somebody has to go into the hospital for a test or anything else, you really have the bases covered where they can feel secure.
Sure. I mean, every hospital's got COVID floating around in it. Yeah. You got to wear your mask. You practice social distancing and wash your hands. You do all the things that we've been, discussing over the last 6-7 months, and then you go ahead and get your test. We've made this easy in regards to testing, and made for peace of mind. We've put it in the back of the hospital, which does not really enter. You really don't enter the hospital. You actually enter an atrium, and like just a double door entrance. You never really come into the facility. You actually stay in the atrium. So you're really not coming in to contaminate the rest of the hospital, or vice versa.
So that is, once again, for the people that are listening, that's the way. And by the way, if you're listening now, you still have questions. Once this interview is over and it's posted at robinhoodradio.com, click on demand, click on the interview with Mark Hirko. You'll see there's a list of things that you have to follow, and there's even links on there as well. So looking at that now, you had a real nice virtual presentation the other day, an update on Sharon Hospital. I think those are really helpful. I mean, what did you pass along to the people that were watching in that presentation?
Well, I mean, these are changing times, and we are again part of a very large health system, and with that, we are now making strides and steps to start pivoting the hospital to services that actually continue to meet the needs of the community today, and then for future needs, particularly as we have an aging population in this region. So we're really working hard on maintaining that. At the same time, we really wanted to show and appreciate the outreach and the community interaction that we've had over the past few months due to the COVID emergency, and how well the hospital and the community have worked together to really help each other. And that's a tribute to the people that live in this region.
I think what's also impressive, there was a note sent out by Region 1 Superintendent Lisa Carter to parents last night that the Falls Village Lee H. Kellogg School is going to go to distance learning through January 5th, beginning today. And it's because of basically a shortage of teachers. With regular calls in for the flu and other teachers not feeling well and waiting to get tests, there just aren't enough teachers to operate the school in the school where they can do it now via remote learning. It appears that you've been able to keep your staff fairly full and strong.
Yes, and every hospital has had people that have been sick. We've been really working hard to maintain, the big three, as I say, about wearing the mask, social distancing, hand washing, and then if you are sick, you quickly identify and let your supervisor know that, and then you could get into the testing protocol to determine if you need to be quarantined at home for a while. So we've really tried our best to again balance the needs of the community and protect our staff at the same time. And it's getting tight, particularly as COVID is pretty much ubiquitous within the community itself. But at the same time, we hope we've reached that peak, and then we're actually having more employees coming back that are going out. So it's a fine balance right now.
I think people tend to lose sight of what we talk about. COVID-19, of course, is on the minds of a lot of people, whether they believe it or whether they don't believe it. It's still the topic of conversation. But normal life at the hospital has to go on, not only for the doctors and the testings and the labs, but for the people that need certain required things. I mean, so the hospital has to operate on two different levels. One, a COVID-19 level, and number two, you're open. You got to help people. That's the business you're in.
And that's where the problem was early on. When the state, we had to shut everything down because due to just the unknown. And now that we know, we're doing our best to maintain normal services, because the stats have shown that people that had delayed relatively routine work early on actually came in with much worse conditions and or really hurt themselves. So we're balancing that. We're trying to add testing, and by the way, we started vaccinations on Friday. So we've got like 4 or 5 things going simultaneously with the same number of staff. And then some of them are ill. So you see that's been the balancing act, trying to do all these things that we have to do and then balance it and still not burn the staff out. So we're really working hard on and really trying to just stay close with the staff, get a good feel of what's going on, and try to anticipate if there are any issues or problems and nip it in the bud, just to keep the spirits up. Because I tell you, it is for all of us. This is a difficult time.
And the vaccinations that you are giving, how long do you think will reach the general public around here when the general public might be able to get?
I don't even want to hazard a guess, because I heard on National Public Radio this morning that the future Surgeon General says he's hoping that the normal or the population that has little risk, he's hoping by the end of summer. Because it's just there's just been delays in getting these vaccines distributed. So we'll take what we can get and then move through it. But the one thing I really want to state too is that we're getting a lot of phone calls and a lot of interest. Everybody wants to be vaccinated, and the way Connecticut has it set up through the VAMS system, the VAM system, is you will be notified by the CDC when it's your turn. You can't kind of jump the line. You can't, tell somebody this. I want to do this now. This agency will determine when you're eligible, and they will contact you, and then you go through the whole process. So it's pretty good on how just how well organized it is. Yeah, there's little hiccups, but boy, the system really seems to work.
And the main thing is, while you're waiting that call, wear your mask, God darn it, and also social distance.
Geez, please. I mean, we've made it this far. We're so close. And I told my wife the other day, I said, this is the part that I dread, in that we do have a vaccine out there, but it's now you've got to wait your turn, and that's what makes you nervous, because you can get something to help you, or prevent the problem, but this is the worst time if you let your guard down, that you still can get infected.
All right, Mark.
Please, yes, we have the holidays coming up, so please, social distance.
All right, Mark, have a happy holiday season as best you can, and keep up the great work at the Sharon Hospital.
Thanks, Marshall, and we'll do our best.
All right, take
Thank
care. Dr. Mark Hirko from the Sharon Hospital talking about vaccinations and COVID-19, of course, and the general operation of Sharon Hospital.